So obviously health is pretty important to our well-being, and we want a healthcare system that delivers health outcomes that are high quality, but also in a way that's fair and equitable and financially sustainable. Where I think economists have a lot of value add is we understand incentives and trade-offs. Economists are very good at understanding whether a program is offering good value for money. They're good at predicting how physicians might respond to different regimes of regulation and pricing and so forth. When you buy health insurance in Australia, typically what people will do is they'll buy insurance for extras, which are things like dental, glasses, physiotherapy, and they will buy insurance for private hospital expenses. So that's usually your elective surgeries like hip replacements and other joint replacements and so forth. However, if you actually go through the details of the plans that people are purchasing, it can be really hard to actually get back more than you're likely to put in. Now, why do we have insurance in the first place? It's normally to avoid catastrophic risks. This extras insurance doesn't really address that fundamental component of insurance. I've worked with colleagues at the Melbourne Institute to write opinion pieces that we publish in The Conversation, kind of summarising our research. Recently, there has been a review by the Department of Health and Ageing into the incentives that exist for private health insurance. Now, that review was kind of released for consultation during this year, and me and colleagues, again at Melbourne Institute, were able to send a submission to that review. We were able to meet and discuss the recommendations from that review with policy analysts at the Department of Health. And again, through our public media engagement, we were able to put our opinions out there for debate.